Hi, I'm Dr. Eric Westman with Adapt Your Life, and I'm with Marylou Hopkins from Virginia. And I'd like to talk to you about your weight loss program that you have there, if that's okay.
That sounds wonderful. So we are in Arlington, which is Northern Virginia, just outside of DC. We have, I am actually a registered nurse and work with a cardiologist, Dr. Eric Thorne. And we've had our program for about 7 years. It is at Virginia Hospital Center through the physician group. We have, our program is set up primarily that all of our patients are seen by the cardiologist for a consult and then taught a class and then do one-on-one follow-ups with me. And then all of their medications, blood work, all of that is actually followed by Dr. Thorne on a, depending on the patient, monthly, maybe every 6 months, depending on what they need.
So it's a very clinical treatment center, people on medications,
Yes.
medical problems and all that. So I wonder if I could pick your brain about how to translate what you know to someone who doesn't need the medical support but needs the behavioral side of things. So let's say, what do you do to help someone with behaviors?
Well, so it's very patient specific. One of the biggest things I've found in my coaching is that everyone is so different, that everybody needs something
So it's
that's
individualized
tailored for them, right?
So that might be hard to find on the internet.
Exactly. And you just never know what little things may be affecting you.
Can you give me an example of a small thing or individual thing that you might not have predicted?
Stress. Personal, could be situational, it could be your job, something like that people aren't actually looking at or looking into as a factor in how they are responding to even the recommended foods. Stress is a big one. And then how we coach that. You can't quit your job if that's what you have to do, right? If this is the only thing you have. So then it's managing it. So maybe for something like stress, I would actually recommend somebody go find a therapist and start working on managing their stress levels, working on maybe even changing something at the job that's causing the stress, or something like family stress. You know, you got something going on in your life. I've seen this over and over again. They'll do wonderful. They're eating right. They feel great.
So
Something
it's not
happens.
just the food that has to change, or there's
No.
more to it than food in a weight loss program.
Right.
Yeah, absolutely.
And maybe finding alternatives. So let's say it is something that you're eating or that something you're missing. So you have a treat that you give yourself like maybe once a week. And it doesn't seem like it should affect you, but then it does. It's finding that alternative. So, you know, I coach real food, right? And I do recommend low carbohydrate real food, but there's also tweaking that has to happen in all of those things, you know? Or my other great one is, you know, you do 20, I do 5 to 10. Because I had a patient that was super frustrated. He comes in and he said, I asked him why he was frustrated, and he said, because I couldn't have what I wanted for breakfast this morning. Why couldn't you have that? He said, because I already had 20 grams planned out for the rest of the meals in the day. And I thought to myself, you know, how many times do we have vegetables at every meal? Maybe one day you'll have 3 times a day, and maybe one day you'll have it once a day. So I coach my patients to do a 5 to 10 grams per meal. And then if that doesn't work, then we tailor it, right? So it's finding a place that works for this patient that you can kind of spread to everyone. But then in that coaching bit, it's trying to listen to what do they need? right? What's going to make this work for them? And let's say it's not real food. Let's say they need a protein shake because they don't want to, or they don't have time, right?
How do you get chocolate?
Right.
You have to deal with that.
Right?
Chocolate shake is one way to do it.
Absolutely.
Real chocolate squares.
Absolutely. If it doesn't work for them, then we'll try something else.
So can you think of any, someone might be watching who is doing it on their own, and what are some red flags when they should probably seek out some help with a trained coach?
If they get frustrated. So, and frustrated with anything. Frustrated with their foods, frustrated with their weight loss, frustrated with their progress.
You mean you don't have to be frustrated when you're losing weight?
Right.
We heard that at a recent conference where people didn't realize how easy this could be.
Right.
And so you don't have to be frustrated. So when someone is frustrated, they should seek help. That seems pretty logical.
Well, so what I find is when you're frustrated, something's off. You're doing something wrong. If you're frustrated, one of my biggest ones is eggs. Okay? So when I have a patient come in and they're like, I am so sick of eggs. I don't want to have any eggs anymore.
I've heard that a few times.
You know what I found to be a trigger to that? Oh, there's a couple of things, but one of them that's really funny is they've had carbohydrates. They've had too much sugar somewhere. So they went out for their birthday and they had a birthday cake. And then a couple days later, I'm so sick of eggs. I can't eat another egg. It's a weird one, right? But what they don't realize is that the sugar drove the craving, and now they don't want the eggs.
Yeah, I've heard that stated in a slightly different way, that if you're bored, it means you're craving sugar.
Right?
And craving sugar comes from eating sugar,
Right.
basically. So yeah, being bored may be just a marker that you're missing the sweets.
You know, and not to mention, like, the frustration piece is the weight. So let's say they're not losing weight. And I'm sure you've seen this a million times. They'll come in and let's say their waist is down. Or they get on our scale, their fat mass is down.
But the water weight went up.
Right?
Yeah, see that all the time.
And so is that good? Absolutely. That's progress. So why be frustrated because your scale at home doesn't move? And I know it's frustrating. And again, if you do have a long period, then we'll start looking at the little details. Then we'll start digging a little deeper and trying to find what's actually affecting you. And sometimes it takes literally them taking pictures of every single food for me to be able to see, oh, you know what? Let's adjust this or let's try that. Portions of vegetables. It stinks,
Fantastic.
right?
Yeah. So there's a role for the behavioral
Yes.
management and helping with people doing a keto diet.
Right.
Yeah, even if you don't need the medical supervision, you might benefit from the coaching
100%.
behavioral side.
Yes.
Great.
I love
Thank
it.
you so much.
Thank you.